I live in Chicago, Illinois. I work for Tiffany and Company. I have gratefully never been a patient at Freighter, but many of my family members have, and so we're big supporters of the organization. Daily life is busy. I travel quite a bit for work. I have a lot of social obligations for my job, and I only live about an hour and 20 minutes away, so it's easy for me to come to Milwaukee. My sister was first diagnosed in June of 1994 with Hodgkin's lymphoma.
The complicated part was that I was pregnant with our first child, Greta, and everything turned out fine. I was treated and had a lot of radiation treatment.
The birth of her daughter, I think, was such a great joy for all of us, and such a great joy during what was really a very strange time for someone 28 years old to be expecting and have that really great miraculous time turned into such a scary time.
My sister Liza, who really quarterbacks it all, has allowed for my husband to really be able to take care of our kids when, I'm either sick or in the hospital or through different treatments. And Liza can kind of take care of me, and it's been really a gift.
My mother was diagnosed in April of 2014 with pancreatic cancer.
I must tell you, the way Dr. Evans presented to me, I was never afraid. He turned around, he said, "You have cancer?" And he said, "But I was so fortunate and that it was curable." And the reason I was so fortunate was one of the reasons was because of Dr. Richard Marks, my orthopedic surgeon. I was scheduled to have ankle surgery, and he insisted that I have an MRI, and it was a very serendipitous find that they found out then that I had cancer.
And then went through treatment of both a Whipple procedure, chemo, and radiation treatments, and is doing really miraculously well.
Liza was unbelievable when it came to the hospital stays, and she tries to keep informed. In fact, she thinks she's Dr. Liza. But the best part of all about her is at home. That's when she really shines. Her cooking is superb. She does every little thing that you don't even have to ask her to do.
I guess I would say my primary role is as chief of staff of their care and their doctor's appointments, and managing the information and following up with additional questions and seeking second opinions and coordinating all the information so that we know what we're dealing with.
I am thrilled that Liza's blogging. She is a perfect person for other caregivers and other family members to seek advice from, because she has seen it all, researched it all.
I'm thrilled that she's doing it.
I'm one of the few people probably involved in this blog that actually has never had cancer, and I hope that we can keep it that way. But it's not just about the cancer patients. There's a lot of information that I think needs to be shared about advocacy for the patient, and I think that this is a great vehicle to do that.